Hey everyone, my name is Tatiana Alvarez Thomas, and I'm here today to talk to you a little bit about binge eating disorder. So, what is binge eating disorder? Well, binge eating disorder is a form of a compulsive eating disorder where an individual will eat large amounts of food while feeling a lack of control and the inability to stop. The excessive eating causes the individual to feel guilt, disgust, and depression, and it can also cause distress because they want to stop binge eating, but they feel they can't. According to the DSM-5, one of the key features of binge eating disorder is recurrent binge episodes that occur at least once per week for 3 months. According to the DSM-5, an average of 1.6% of female adults and 0.8% of males in the United States suffer from binge eating disorder. Binge eating is more common in white females and those who are actively seeking weight loss treatment. While this disorder usually manifests around late teens to early adulthood, it can develop in adulthood. Most people associate binge eating disorder with overweight and obese people, but binge eating disorder is distinctly different. People who are obese do not necessarily engage in recurrent binge eating, and binge eating disorder is very distinct from obesity. The recurrent eating and binge cycles cause great distress for the person with the binge eating disorder, and this stress only contributes to the formation of a vicious cycle, which makes it difficult for the affected to quit. Now, I talked about binge eating episodes. What is that? Well, a binge eating episode is described as the following that's on the screen. Someone who is eating much more rapidly than normal, someone who is eating until uncomfortably full, and someone who eats alone because they are feeling embarrassed by how much one is eating, and also feeling disgusted with oneself and distressed and very guilty after a meal. It is important to note that binge eating is not associated with the recurrent and inappropriate compensatory behavior, as in bulimia and nervosa, and that of anorexia nervosa. The DSM says that's really important to point that out. Now, what are binge eating cycles? Well, the binge eating cycle can be exhausting. A person can go days or even weeks without having an episode of binging. Then, out of nowhere, they're triggered back into the cycle of eating to excess while feeling out of control. And then afterward, they are overcome by feelings of guilt, shame, and regret. Binge eating can be a coping mechanism for some people, and eating can bring comfort to a person who's facing great stress or outstanding circumstances. But usually, the comfort changes very quickly to feelings of regret and self loathing. So, symptoms. What are they? Well, the symptoms and effects of eating disorder are many. So, as you can see on the screen, the effects of binge eating disorder are great. There's a lot of things that can happen medically because of the types of food that are being ingested. For binge eating episodes, a lot of times the foods that are being ingested are bad foods, things that are forbidden or just not good for you. So they're going to be high in trans fats, sugars, sodium, and all that bad stuff, which will all lead to the medical conditions that you can see on the screen here. Not only are there health effects, but there also are behavioral symptoms that we need to be aware of. So the inability to stop eating or control what you're eating large amounts of food in a very short time, having no set meal times, eating normally in public but in excess in private, and eating when you're full or not hungry are some signs that are behavioral concerns. Some emotional concerns, well, let's take a look. Having intense feelings of stress and tension, feeling numb or detached, feeling embarrassed over how much is being consumed, and being unsatisfied no matter how much you eat. feeling of disgust and guilt after overeating. So it's important to be aware of those symptoms that people with binge eating disorder go through. So, what causes binge eating disorder? Well, little is known about how binge eating disorder is caused. Binge eating disorder appears to run in families, which may reflect genetic influences. Binge eating can be associated with high levels of significant psychiatric comorbidity that is comparable to those of bulimia nervosa and anorexia nervosa. The most common comorbid disorder are bipolar disorder, depressive disorders, anxiety disorders, and to a lesser degree, substance use disorders. The psychiatric disorder comorbidity is linked to the severity of the binge eating, not the degree of the obesity. So, is there any hope? Well, yes. Treatment options are there. Treatment is definitely case dependent and may trigger binge episodes or mental health issues to arise as people are going through treatment for the binge eating. There are multiple types of therapy available out there for people who are experiencing binge eating. It really just depends on the person, what their trigger is, and how they respond to different things. So it's really important to make sure that the counselor and the patient are talking, and a good treatment plan is made that is client focused, and there's lots of feedback. So I hope you guys learned a little bit about binge eating disorder. Um, and there are some resources and references in the back of the slide deck. If you have any questions, please feel free to reach out. Thanks.